morning. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. We are pleased to offer today's webinar on women and heart disease, your best interest at heart, in collaboration with Friends Health Connection. Heart disease is the #1 killer of women. In fact, more women die of heart disease than all forms of cancer combined. During today's webinar, we will focus on heart disease in women and look at their unique risk factors and heart attack symptoms and discuss what women can do to help prevent heart disease. Our guest today is Dr. Rachana Kulkarni, a senior cardiologist who is the former chief of cardiology and chairman of medicine at Robert Wood Johnson University Hospital, Somerset. She currently serves as president of the American Heart Association of New Jersey and has been recognized as a woman of distinction for her role to raise awareness of heart disease in women. So thank you for joining us today as we kick off National Heart Month. So thank you again, Dr. Kulkarni. We will begin our webinar today with about 20 minutes of moderated discussion, followed by questions and answers from our audience. So Dr. Kulkarni, let's begin, if we can, with you sharing a little bit about yourself.
Sure. Serena, first of all, thank you for that nice introduction. That's very
pleasure.
kind of you. I have been a cardiologist at Robert Wood Johnson, Somerset, and New Brunswick for the past 21 years. This is my 21st year. So I've been here for a long time. And when I started, I was the only woman cardiologist in the county. And I saw how much heart disease is not recognized on multiple different levels by the women, by their family, by community, and by physicians. So I made it my professional life mission to raise awareness of heart disease in women and the communities at every single level. And so I joined American Heart Association's Go Red for Women movement. And
Go Red today.
Go Red today. And today we mark the 15th year of Go Red for Women. And later, I would love to share what progress has been made in that movement. And it shows that if you start and build a movement and the cause is right, how enormously successful it would be. So thank you for having me, and I look forward to this webinar.
Oh, wonderful. Well, you mentioned that you started this movement. Do you think most women today are surprised to find out that they are more likely to die of heart disease than cancer?
Even today, yes, but a lot less. When we started the movement in 2004, I believe, more than 90% of women did not know that heart disease is their biggest risk. Now, 65% of women do know. Still, we have a lot of progress and a lot of ways to go, but 65% more women know that heart disease is their biggest risk. And anytime I have given a lot of lectures and a lot of seminars on this, and one thing I want women to remember is heart disease is an equal opportunity killer. Pay attention. And as you said, heart disease kills more women than all cancers combined. And still the perception, even today, which is prevalent, is breast cancer is their biggest risk.
Interesting. So I was going to ask you, because you mentioned about 64%, is there a general awareness among women of how serious the risk factors are, or do you think there's still, it seems like there's still more work to be done?
For sure, there is still a lot more work to do, because it's one thing to understand at a conceptual level that yes, heart disease is your risk, but then what can be done about it is the next step, and I think we should take this opportunity to talk about it.
Okay. Well, what are the risk factors for heart disease? Can you share with us what they are?
Yeah.
I mean, is there bigger risk factors? Do they play a bigger role? Do some play a bigger role in developing heart disease for women than others? So why don't you?
Sure. So risk factors for heart disease can be divided into two categories. One is modifiable, one is non-modifiable. So let's talk about the non-modifiable risk factors. Our age, postmenopausal women will have higher risk for heart disease. Sex, women tend to present with heart disease a decade later than men. Another very significant risk factors, and for this, I think conversations need to start around Thanksgiving table and family gatherings, is our family history, because that's the genetic package we are dealt with and born with. And that over 25 years of practice, I have seen that that is such a tremendous risk factors. So know about your family history. If people in your family have had heart disease, then you're more likely to have heart disease and you need to be more vigilant. It's no different than if a person in your family has colon cancer, you need to get screening colonoscopy earlier than the general population. This goes the same way.
Very good.
And then we will go to modifiable risk factors.
Okay.
High blood pressure, diabetes, high cholesterol, sedentary lifestyle, smoking, physical inactivity are the modifiable risk factors. And we got to do something about it. We need to do something about it because 80% of the heart disease is preventable. And this is, studies have shown that most heart disease is preventable if risk factors are identified and addressed. So I think the ball is in our court now. We can do a lot of things if we choose to.
So tell us about like the role that like stress, depression, or maybe metabolic syndrome also play on the heart. And if you could, can you prioritize which of these risk factors have a bigger impact on us than others? Where that focus should be in terms of prevention, maybe?
Two great questions, by the way.
Oh, thank you.
And two very important risk factors that I can say. First is diabetes, and that ties into metabolic syndrome because metabolic syndrome predisposes us for diabetes. Metabolic syndrome, diabetes, sedentary lifestyle are unintended consequences of our fortune to be living in a very affluent country. Okay, we show love by food. And we don't walk anymore. We all have cars. So all of that ties into rich food, lack of physical activity, and we know we put in more work hours than any other nation. And so stress, that brings stress. So stress at work, all of that ties into increasing visceral adiposity. So that's the bad fat. Any fat is bad. But if we have visceral adiposities, it predisposes more for insulin resistance and diabetes. And I will summarize this very quickly that a woman with diabetes, risk of heart disease in a woman with diabetes is 7 times higher than a woman without diabetes. So that's one huge risk factor, prioritizing diabetes. If you can control it, if you can avoid it, if you can do any measures to avoid diabetes, you do yourself a big favor. And second biggest risk factor that is modifiable is smoking. I cannot say enough about it. There is nothing good that comes out of smoking or vaping, I should say, because vaping is, it's the same thing. And it continues to increase your risk of heart disease, just like cigarette smoking. Those are the two, if we can prioritize. Taking care of your cholesterol, your high blood pressure are other important risk factors. But if I have to pick two, those were the two top.
Okay. And you mentioned visceral fats. So visceral, you know, for our audience who may not know, can you explain, is that mostly stomach fat?
Exactly.
Found in your stomach? And can you explain how that is connected again, why that impacts on heart disease?
Visceral fat is supposed to be more atherogenic and difficult to get rid of, and it also decreases your sensitivity to insulin and increases your predisposition for diabetes. So it becomes a perfect storm.
Great, thank you so much. But you also mentioned women who are postmenopausal have higher risks. So how does a woman's risk increase after menopause? Can you explain a little bit why that changes?
Absolutely. When a woman loses her estrogen protection by going into menopause, the estrogen slowly weans off. And we always say, we can do everything in medicine, cannot compete with the guy upstairs. The way he has made human body. So when you lose your natural estrogen protection, your blood vessels become more atherogenic. Your cholesterol level goes up. Your propensity to have that extravisceral tire goes up in women after menopause. And that all translates. So this happens over a process, as we all know, over 5 to 10 years. And as a result of that, you start seeing heart disease presenting in women within 10 years of their menopause. So heart disease presents in women a decade later than men. And that's a very important concept to understand, because when heart disease presents a decade later, women are older by then. They have significant more comorbidities, because that's the time frame when you start noticing high blood pressure, weight going up, other comorbidities such as diabetes, high cholesterol, obesity, arthritis, they all start creeping. So men typically see heart disease more in their 40s and 50s, women in their 50s and 60s. A lot of times, if that is not recognized, even in 70s. So as a result, the disease could be more advanced. Lack of knowledge, lack of awareness at multiple different levels can delay treatment for women. As a result of that, the outcome as such, the side effects of procedures or the feasibility of procedure changes. And as a result of that, more women die of heart disease than men for the last decade.
Thank you. So you had mentioned about, our estrogen being depleted. So, we used to think that hormone replacement actually used to be a way, had benefits for women's hearts, but recent studies are saying that might not be true. So can you, explain this and maybe elaborate on why that is not so?
And that's why I said can't compete with the guy upstairs, because the conventional wisdom was, so women lose estrogen protection, so give them estrogen, right? And then it will all be better, and we will be good. And that was the conventional wisdom. That's why everyone was put on hormone replacement. And then studies were done, as they should be, because you cannot base medical decisions based on anecdotes or based on what we think is right, but it should be based on data. And so 2 very well reputed studies were done over a period of many years, and the results were really sobering, that it did not make a difference. Artificially given estrogens did not make a difference in heart disease in women. Also, it increased your risk of any kind of thromboembolic event for the first 1 to 2 years. So now, guidelines by American Heart Association and American OB/GYN Association is you do not take estrogen to reduce your cardiovascular risk. If you do it for other reasons, other GYN reasons, that's different, but not for prevention of heart disease.
Very good. Well, studies do show a lot and tell a lot. So we know they also show that women are more likely, generally have heart attacks a decade later than men. And are more likely to die from these heart attacks. Can you explain why that is as well?
Yes, because women, by the time heart disease presents, it's usually a decade after menopause. So women usually present a decade later because they start having issues such as high blood pressure, high cholesterol, weight gain, diabetes, all of that a decade later. And that's why by the time heart disease presents, women have a lot more other comorbidities. They're older, and that's why it precludes sometimes to get treatment. Women are also notorious about not seeking treatment for heart disease. There was one peculiar study that was done that I always find speaks volumes, that women will call 911 and seek help for if their husbands, if their family members, if their friends are having problems. They will not call 911 for themselves. Also, there was a study which was done that showed that women delayed calling 911 when they were starting to have heart problems. They wanted at least 10 minutes delay to tidy up the house before EMS came.
That's a very interesting study. I have not read that one.
Isn't that amazing? But I totally believe that.
I would not have said, you know what, let me stop everything. I got to tidy up the house during my heart attack for EMS.
The EMS will come. What will they think?
Oh my goodness. Well, when women are presenting, what are the signs and symptoms of heart attack, and how are the signs and symptoms of heart attack differ for women? Could you explain that?
Absolutely.
Just in case you got to call the EMS.
We are dressed up. We're good.
I got to see if the office is clean. Go ahead.
So, you know, we have talked about why heart disease is not recognized, because typically heart disease was perceived as men's disease, and the symptoms we knew is chest discomfort, pressure building up on your chest, and sweating, diaphoretic. In women, the symptoms could be a little different. A lot of times the presenting symptom, the most common presenting symptom could be shortness of breath. They're atypical, they're more vague symptoms that women can present just with shortness of breath, feeling very tired, very fatigued. When shortness of breath presents as the main symptom, most women tend to write it off, thinking that it's because they're overweight. If I lose those 10 pounds, that shortness of breath is going to get better. And believe me, I see it day in and day out, every single day in my practice. Most women say, oh, doctor, I'm getting short of breath, but I know what it is. If I lose those 10 pounds, it's going to be better. Or sometimes the symptoms are just feeling fatigued and tired. And we all know we are constantly, through our entire life, we are in a balancing and juggling act. So we feel we are overworked. We are constantly stressed. So, you know, it's natural to be tired and fatigued. So those are the two symptoms which kind of get overlooked. A lot of times women feel indigestion. That is true for men and women both. 1/4 of the heart attacks go unnoticed because it's written off as indigestion. So, you know, those are the symptoms. The patient doesn't know that she's having the symptoms. Her family also does not recognize those symptoms quickly. If you go to physicians, it's likely that these are atypical symptoms and could be written off. And that brings me to a very important point, because, you know, heart disease was studied, and what is written in textbook is based on clinical trials. And up until a decade ago, most of the people who entered clinical trials were men. So women were never studied. So they never became part of the guidelines. They never became part of the textbook, because everything was derived from research on men. So American Heart Association made it a point to involve and to promote involving more women in studies. So now you will start noticing the percentage of women in clinical trials for the last 10 years has steadily gone up with the efforts of American Heart Association. So for new physicians now, actually next week, I'll be giving a seminar at Robert Wood Johnson med school students to educate them on heart disease in women. So now the doctors in making know about what are the differences and how to identify and how to be more vigilant about this entity and how things can present differently. So they have to be more proactive, more vigilant. And webinars like this increase the awareness at a societal level, at an individual level, at a societal level, community level. So everyone is more aware to be mindful and not write things off.
Absolutely. So you said, just to summarize, the differences are really women will experience shortness of breath, fatigue. Is there any pain, like, typically when people think, oh, I'm having a heart attack, they feel pain in their chest. Will women feel the same, or will they experience different pain in their body?
They could. Okay. Well, the typical classic symptoms are chest discomfort. It's never what is described in a movie. People don't clutch their chest and drop it down. It's typically chest discomfort. A lot of people describe that as a squeezing sensation, elephant sitting on my chest. Chest pressure that builds up gradually. It is usually precipitated by physical exercise, but in women, it could also be precipitated by stress. And God knows we have plenty of that.
Oh, yes, we do.
Stressful situation in feuds or at work, family. If you start noticing pressure-like symptoms building up on your chest, pay attention. If you see a cold sweat, you're getting that with that chest discomfort, pay attention. That chest discomfort, if it goes a lot of times in women, it can go to their jaw, it can go to their shoulder or back. Pay attention, get it checked out. It's always better to be safe than sorry.
Absolutely. So we know that signs and symptoms between men and women differ. Do treatments between men and women differ? How you treat a woman who's had a heart attack, for example?
Unfortunately, more women die of sudden cardiac death because they delay seeking treatment. It's a very sad thing, but more women die of out-of-hospital cardiac arrest than men. So get treatment, because if it's too late, we can't treat you, can't treat flatlines. So avoid that, get help. If you sit on a heart attack, or if there is delay, sometimes heart attack, we call it completed myocardial infarction, that there was too much delay and now the blood vessel is completely clogged. It happens more in women than in men, and then you cannot put a stent in. So time is muscle in heart disease, or heart health, I should say. We say time is muscle, get help in a timely fashion. If you're noticing you're having symptoms of chest discomfort, have aspirins, 4 baby aspirins, chew them, and call 911. Don't tidy up the house. Call 911.
Aside from aspirin, what are other things or ways women can do to prevent heart disease at each stage of their life? Maybe even starting as early as 20.
Absolutely.
Through their postmenopausal years. What can we do?
Know your numbers. That's the most important things. In medical literature, we call diabetes, high blood pressure, high cholesterol as silent killers. They by themselves will not give you any symptoms. If you are having headache, you will reach out for medicines. If you're having backache, you will reach out for medicines. But you will not have any symptoms with diabetes. You will not have any symptoms with high cholesterol. So these, you have to take a proactive role to go to your physicians and get it checked. So know your numbers. If you know your numbers, have a conversation with your physician that what can I do? Let it be a partnership. What can I do? If that means exercising more, if that means eating right, if that means quitting smoking, do it and follow up. If you know your numbers, typically people have, I see this all the time, people come with cholesterol, which are pretty elevated. And I ask them, how long have you been known? So they said, 10 years. I'm just trying to get this down. While you're doing that, put yourself, I strongly believe in short-term goals. Okay, we are going to, if you see high cholesterol numbers, let's take these measures, see you in 6 months and see if the numbers improve or not. Otherwise, take measures.
Yeah, so is that when women should actually start to talk to their physicians about heart disease if they see their numbers are going, or are above the normal ranges, and perhaps if they're starting to feel that tightness in their chest?
I wouldn't wait that long.
You wouldn't
I would
wait?
know your numbers in your 30s, and I would follow up. Always good to adapt. It's never too early to adopt a healthy lifestyle.
And what are some of the questions maybe we should be asking our physician?
What are my numbers? Know your family history. Very important. What is my blood pressure? What is my fasting blood glucose level? What is my lipid profile? How much exercise should I do? If my numbers are high, what measures can I take to improve these numbers? Very important.
Oh, great. And I just want to go. Thank you so much. That's
you're
wonderful.
welcome.
What I would like to do now is just open some questions from our audience.
Sure.
And I can see everybody's already been posting. I think we did go over the signs of heart disease, but this person specifically is asking, the other day I had pain in my chest, but wasn't sure if it was stress related or something serious. So how is somebody to know the difference between, you know, something that is actually, you know, specifically related to heart disease or heart attack versus just maybe stress?
It's difficult. And that's why I say, when in doubt, get it checked, because we have only one heart. So if symptoms, typically chest discomfort with any heart issues, builds up gradually. And then once that situation is resolved, it should resolve. If it's pressure-like inequality, it's more likely to be cardiac. If there is a known precipitating factors, it's likely to be cardiac. So if you're having chest discomfort, which is sharp, which comes as a twinge, if it comes as a sharp pain, comes as twinge, lasts for seconds, unlikely to be cardiac. If you have chest discomfort, which is mild to moderate, it's like a nagging quality. It builds up gradually. It feels like a squeezing sensation. And then it comes on either with physical or emotional stress, and then is relieved by rest or cessation of that stressful situation, more likely to be cardiac, more likely to get it. You're better off getting it checked. And of course, know your risk factors.
Are there any meds that can have side effects, you know, or that it can affect the heart?
Good question. There are some chemo agents, and when people are treated for cancer, we usually get their heart checked, because certain chemo agents can affect heart and can affect the heart muscle. Alcohol, we didn't talk about that, but excessive alcohol.
You're going to tell me I have to give up alcohol?
No. See, we have good ways. 1 to 2 drinks is okay. And red wine, if you have to choose, red wine is good. But any excessive alcohol can be toxic. Excessive alcohol also, we call it holiday heart. During holidays, people binge drink. And you see a lot of young kids, men and women, they present to the ER because now they are into atrial fibrillation because too much partying went on for the holidays.
So we talked about smoking earlier. So if somebody had actually smoked for 10 years and then stopped at a healthy lifestyle, how much damage would have been done from the smoking, and would it be reversible? Could you tell us about that?
Quitting smoking is the best thing you can do for yourself. Typically within 5 to 10 years, the cardiac effects are negated. But there are other things to watch for, such as pulmonary.
Okay. Very good. This next question, we know that diet and exercise can really play a role in heart health. Can you elaborate on how they play a role in heart health?
Yeah. I would encourage you to go on American Heart Association website. They have given Life Simple 7, how simple 7 steps in life can improve your heart health. And one of that is exercise. So 30 minutes of exercise, 5 days a week. And it should be 30 minutes of aerobic exercise, such as biking, exercising, brisk walk, nonstop. Brisk walk, 30 minutes, 5 days a week. If you do that, or 115 minutes for the week, it improves heart health. Because it improves your heart health, exercise also is taking time for yourself. It improves your mental health, heart health. It improves glucose utilization, thereby helping you with diabetes. So exercise goes a long way. It improves your cholesterol number. We as a nation are growing getting bigger and
Mm-hmm.
bigger.
Mm-hmm.
That is because of the food and sedentary lifestyle. So if we all can make this New Year's resolution or February resolution to get ourselves 30 minutes of aerobic exercise 5 days a week and get moving, we all will do our heart a favor.
So the next question is regarding diet. Is there a specific diet that's best for heart health? Like what are your thoughts on the keto diet, or I guess the J-Lo diet? You hear all these different diets out there. J-Lo is like no sugars or carbs for 10 days. But what is the best diet for heart health? Mediterranean diet?
Every week we have a new diet, right? And because being overweight and obesity has gotten to be a big problem, and diabetes and cardiovascular disease has gotten to be a big problem in the nation, and that's why we all want to lose weight. How do we do that? Oh, it's fast, easy. Let's get on a diet. I personally don't like the concept of a diet because, in my opinion, diet is destined to fail because you do it for a limited time and then you see results and then you say, okay, it's time for me to go back on my usual lifestyle. What you want to do is incorporate healthy lifestyle. And for that, simple things, cutting back on saturated fats, cutting back on red meats, cutting back on carbohydrates. Not like go for complex carbohydrates, simple sugars, simple carbohydrates. If you cut back on that, I talked about saturated fat, and try to incorporate 5 servings of fruits and vegetables. If we incorporate that, I think that's as good as any diet. If as a physician, if I'm asked to pick one diet, my favorite one, if I ask people if you have to have, I personally like the South Beach diet because one, it's developed by a cardiologist. Second, it is a diet that makes sense. It's lean protein and salads. So I think it's the most reasonable diet, but I think healthy lifestyle is what we want.
Oh, great. Well, I think you covered a lot about weight, because I know this one question is about how does weight affect heart. We talked about the visceral fat, so it's really important. There's definitely that connection and correlation. Now, this next question, you had mentioned about baby aspirin and taking baby aspirin. The question is it true that it helps the heart, and why or why not? Or how, maybe that's the question.
Sure. In 2018, there was a lot of controversy about baby aspirin and who should not take aspirin. So anyhow, that is a conversation every individual should have with their physicians and healthcare professionals, because high-risk individuals are benefited by taking aspirin. It goes a long way, and it has to be weighed against your risk of GI bleed, which is the main concern with aspirin. But coated baby aspirin taken daily with food goes a long way for high-risk individuals. And the reason is every heart attack, anatomy of a heart attack, is plaque buildup in our blood vessels. Plaque starts building up in our blood vessels because of high blood pressure, diabetes, high cholesterol. And when plaque builds up, it's the platelets in the blood that get sticky and they start piling over each other. Aspirin makes the blood less sticky and reduces risk of plaque and thereby blockage buildup. And that's why a baby aspirin goes a long way. Not Advil, not a leaf, one baby aspirin, which is 81 milligrams to be taken with food.
Okay, and I think we'll take our final question because I know we're a little bit over our webinar. This question from the audience is, I tried the South Beach diet and was starving the whole time. Why? Nothing felt filling. So, like her husband didn't have a problem with it, but obviously she did. Can you maybe explain why, maybe as a woman, we maybe didn't feel fulfilled with that diet and the husband did?
My opinion is, that everybody is different. If you do not feel full with South Beach diet, couple things I would suggest is one, have the salad portion of it for, before you go for the main meal, and give yourself 10 minutes gap. Have salad, big glass of water, 10 minutes gap before you go for the whole meal, full main course. The reason being is there is a little lag time between when we eat and when our brain registers us as being full. So that's why, you say, okay, eat your meal slowly, but if you give like a good 10 minutes gap, it may help. So give that a try.
Very good. Well, thank you so much. Thank you, Dr. Kulkarni.
Oh, I'm so glad that the audience was engaging. So that's great.
Well, thank you all for joining us today. This concludes today's webinar. Please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from a physician. If you need a physician, please call 1-888-MD-RWJ-UH. For more information about Robert Wood Johnson University Hospital Somerset, visit our website at www.rwjbh.org/Somerset. Thank you again for participating, and we hope to see you soon. Have a great day.
Thank you.